Today is World Tourism Day. We're still going to talk about that on top of the hour at 9 o'clock. But Wednesday is World Heart Day. And so on this program this morning, we are looking at how the world can actually access health, heart care, not healthcare, and heart care, how we can actually improve access to heart care, because Wednesday this week is World Heart Day. We have in the studio with us Dr. Francisca Inofomo. Did I get that right? Inofomo. She's a consultant, physician and cardiologist from OUTH here in Ogun State. Thank you so much for joining us.
Thank you for having me.
Welcome.
Good morning.
Okay, World Heart Day on Wednesday.
Yeah.
Now, the theme for this year's celebration, how did it come about? What actually informs that theme?
Okay, every year, together with the World Heart Federation, there's this global event, World Heart Day, 29th of September. So because of the huge burden, cardiovascular disease, which is the #1 killer even of all non-communicable disease. I remember last year was about 13.9. This is 18.6 million deaths every year due to cardiovascular disease. And unfortunately, 18.6 million deaths.
Globally?
Every year. Yes, globally. Globally. And out of that, 80% of that occurs in low middle income countries where we fall into. 80% of that. And out of that 80%, a larger percentage occur in the young. So we said we must use heart to beat cardiovascular disease. And this year, the theme is use heart to connect. Use heart to connect with your own heart, because the heart does speak to you, with everybody's heart, and especially with those hearts that are damaged. An isolated heart is more at risk. So that's how we are out this year, to stress the importance of using heart, your passion, your knowledge, your influence to connect every heart. And it goes further to help us to further reduce the burden, of cardiovascular disease. And it comes in like 3 different pillars. Okay, we are looking at equity. What does it take to use your own heart to connect every heart? And one of the major reasons is why we are here today. Okay. We all know that COVID-19 had caused a lot of issues with the health sector. So we are looking at, despite the pandemic, despite the fact that people are not connected, some people, especially those that have background cardiovascular disease, they are not able to access the hospital. I realize that about 520 million of them that have been affected have more deaths because they have background heart disease. So we looked at it that this year, let us harness the importance of digital health, the importance of the digital technologies to bridge the gap in any way as much as possible. And that's why we're here, so that we can reach out to more people through the media, through various digital devices that we have, phones, calls, to be able to reach every heart. For example, me and you are here today. We know that we can easily make calls. Unfortunately, everyone with risk factors out there like hypertension, diabetes, before they reach their doctor, the first person they ask is a friend. They ask, or better still, they go to a chemist. We are saying, use your position. If you are better informed, knowing that the heart is the most fragile organ, is the smallest, but is the one that does most of the work, anyone that comes to you can easily refer and advise the person appropriately. So that's using heart in your own way to connect to that heart. That, oh, friend, I think it's better to seek help at the best place. Okay? Also using heart to connect with everybody in the community. It's advocated that use your position. Every community should have at least a primary health center, a primary health care facility, community health workers that can easily go out to inform people, give them the knowledge what is needed, check their blood pressure, give proper advice. There are so many myths out there and wrong impressions about heart health that people just take, and everything goes so bad before they come to us. So we are saying there are so many things we can do. There are digital apps that people can use to connect to their hearts. For example, I wear a Fitbit wristwatch. It helps me to keep active. That is part of the digital technologies we are trying to pursue. We are trying to tell the public that they can use. They can check their blood pressure with a device phone. It might not be accurate, But at least it gives you an idea of what is going on with that heart. You have a health post in a community health center where everybody can easily reach out to, even before they get to the general hospital or to the teaching hospital. Okay? And also, for those that have background disease, you have elderly people around you. If you are well informed, you are able to advise them proper. Oh, Mama, if you feel dizzy, or if you feel very weak, you do a little distance, you are weak. This is likely the problem. Let's seek help. The elderly woman might not have a smartphone, but you have a phone that can use to connect them to a doctor or to a nurse. So we are saying everybody should take that responsibility of connecting every heart together, and don't say because of pandemic, let that heart suffer or let them be isolated.
Okay, for those that you know, are in the rural communities, and of course you talked about the background diseases and all that. Are they going to spot the particular thing that is wrong with them?
Okay, so that's where the awareness and the education comes in. Okay, so that's one of those things we are preaching. One of the handle. The awareness is that you should know that many of the risk factors are silent killers. Okay, so every adult, before it used to be 40, now we say 35, with a family history, should go out there and consciously check, speak to a specialist, speak to a doctor, okay? You might not know until you check, because it is a silent killer. So we say once you begin to feel tired when doing your normal daily activity, please go out and check at least your blood pressure, know your numbers. For the rural women that probably go to farm regularly and they realize, oh, I do this before, I can't do it anymore, it's time to go out and check. 2, what we eat forms us. So we are teaching them that they should try and as much as possible to avoid high salt consuming foods. Very important. In fact, what you eat goes a long way to reduce your cardiovascular risk. Okay? Being physically active is important. Avoiding smoking. If I said that if you're able to stop smoking, it reduces about 2.5% of your risk of having a cardiovascular disease. Unfortunately, realize that smoking does a lot of damage even to the vessels. And we know our elderly people, they do tobacco. They do a lot of tobacco products, and it's a regular practice. So they have this continuous damage of their vessels, though the heart might be working well. But the time the heart says, oh, I'm tired, I'm not doing this anymore, it's the complication, it's a heart failure. And that's what they present to us. So what we are trying to, before it gets to that level, watch your lifestyle practices. Tobacco smoking, doing excessive work, not listening to the heart when the heart says I'm tired. Sometimes they have palpitations, undue awareness of the heartbeat. Those are early signs they can pick and reach out to the hospital before it gets so bad. Sometimes they have leg swelling, which is a sign of heart failure. Sometimes they cough so much at night, they are breathless. Once you realize that you cannot lie down flat without using 2-3 pillows, or realize you have to sit down too, or you keep coughing so much, and these are signs of heart failure. Once you have that, you can easily come out and seek help. And then you can consciously avoid obesity. I don't say I have come of age. I mean, I have maids, I have staffs. They can do that for me. Be physically active, okay, so that you don't compound your risk. Each of these risks are multiple, combined together, there are multiple risks to the heart.
Smoking, I'm very, very interested in that. We see a whole lot of people that smoke, and they go on, they live a very long life. I've seen examples of people like that, and they will say, oh, for them, smoking is not dangerous.
Well,
yeah, what do you have to say to them?
Smoking is the number one, is the most important risk factor that if you can do away with, you gain back 2.5 of your heart year. If you can stop smoking, it takes you about 2.5 years for you to regain back that function.
What about those that have never smoked before?
Okay, fine. There are multiple risks.
Okay.
For example, you said that some people smoke and they live long. Well, they might be lucky. Now, what do they smoke? Many of those contents are toxic to the heart itself and to the vessels. Unfortunately, we see a lot of, they used to say heart attack is rich man's problem. Not anymore. These days, we see a lot of heart attacks among young. are young that want to make it fast in life. They do hard drugs, cannabis, marijuana, shisha, and all that. They all have their adverse effects on the heart. In my clinic, nothing less than 2%, at least 2 in 10 are young chaps. Young chaps that the only risk factor I'm able to find in them, why is this heart behaving this way, is because it's been involved in one form of drug or the other. And we have to do a whole lot of rehabilitation to help. So smoking damages the vessels. In fact, it's said that if you don't want to quit smoking, there's no point trying to help that heart. And there are different steps to help that individual. We have steps to take to help because we know it's an habit. It's difficult to stop. So there are steps we use to ask to help to abstain. Sometimes we go as far as giving them supplements to help prevent that addiction of smoking. So I would say that smoking is a whole lot of risk factor that we should, as much as possible, avoid to live a healthy life.
So many years back, gaining access to Heartcare in Nigeria, was quite problematic. In fact, it was said that Nigeria, there was no place you could do heart surgery in Nigeria.
Oh.
Now, what has happened today?
Yes, I'm glad to inform that though we still have the challenges, but that has changed. We recently finished the Nigerian Cardiac Society conference. NCS turned 50, and at that conference, we were able to harness what resources we have in the country. We can't do heart surgeries in the country. We have a lot of specialized places where it's done. We have UNTH Enugu, we have in Abuja, both public and private sectors. Okay. Even in Ogun State here, we do have. Even in OETH, we have the human resources. What we are calling on our government, they have done a lot. Yeah. But they should help us more. All these things can, once we have all those gadgets, we are going even into interventional cardiology. Okay, we need to equip our cardiology lab easily. And talking about access to heart care, it is when you know you need care, you know where to access it. And that is why we are not keeping quiet. We are here today to let them know, make use of what you have. I mean, this is reaching out to everybody to know that, OUTH is a place you can easily get cardiac care, okay? You can always ask, you can check on the website, www.outh.com, check the website, click on wanting to, there's a facility to chat on that website. Put in your complaints, ask to speak to a specialist. They will direct you. You can go into the medical records and get an appointment. We run a clinic every Wednesday. So this year, we are not going out. We'll be in the clinic and have an expanded care.
Well, of course, on your website too, there are contact numbers.
Yes, there are contact numbers on the website.
Okay, so, but the first place to go to is the website.
The website. And you can also send a mail to a complaint mail, complaint@gmail.com, outhcomplaint@gmail.com. Have those informations on the website. And there are dedicated lines that can be called.
Have the website again.
Okay. Let me just get that quickly. So be sure that we are giving the right thing out.
As we're trying to check for so let's also talk about how affordable this care could be for an average person.
Yeah, because that's very important.
People know where to get new people, and then how is it going to?
Okay, sure. We all know that OUTH is the only state-owned teaching hospital, and it is accessible and affordable. I mean, you get less than 1,000 naira to obtain a card to see a specialist.
Okay. The only state-owned teaching hospital?
Yes.
In Nigeria?
In Ogun State.
In
Nigeria.
In Ogun State. In Ogun State. Okay, sorry, the website is https://www.outh.com.
Okay, that's very simple. Okay.
And then you have a complaint line that can easily reach. Do I call that right away?
Yeah.
081-6370-1056. You can always call that line to book your appointment or to make a complaint or to fix an appointment. Anyone, and to even request for what facilities we do. We can do ECG. ECG is one of the easy, affordable, accessible heart investigation that anybody can do. It checks the electrical activity of the heart. It tells you about the rhythm. I can easily pick while this person is getting tired, why she's having fainting attacks and all that. And ECG, at least you know ETH, is still very cheap, relatively cheap. Okay? It's about 2000, 2005. We do echocardiography, we do heart scan. Okay, sometimes when we have philanthropists, when we have people coming to donate, we could even run ECG free for some group of people, especially in the elderly. Okay, it is important that everybody have a baseline ECG so that when anything goes wrong, you know where has it changed from.
When will OETH come to GTV to
We said that last year. Anytime you invite us, we'll be here to do that for you.
Okay, I think this is an open invitation now.
Yes, an open invitation.
Anytime, no problem, we would come down.
No, but you see, generally speaking, because there is so much ignorance out there about heart diseases and all of that. So what would you say, what level do you think Nigeria has actually reached in terms of, making our people get access to heart care?
Well, I would say that the professionals are trying their best. The professionals, the community of cardiologists, both adults, pediatrics, interventional cardiologists, are doing a whole lot to make themselves available and accessible. However, in fact, in the Punch this morning, my president, the president of Nigerian Cardiac Society, made a claim that there are just about 500 cardiologists taking care of 200 million Nigerians. And the number is decreasing, no thanks to the brain drain. Our sector is also affected by the brain drain. So the human resources are there. We are struggling to keep it up. It's about passion. I mean, that's why we're here. But resources, thank God for the private resources, the private people available. They are able to help bridge the gap. And that's what we are saying. In the developed world, there are wearable devices that connect the patient to the cardiologist. I mean, I don't have to be there. You wear a device, you have an abnormal reading, I pick it up in my office, they're able to check an ambulance and pick. In Nigeria, we have those devices too. Funny enough, we do have them. But maybe in a little bit civilized and more sophisticated environments, okay? In places where they have the resources. For example, in OETH, we have something you can do, an ambulatory monitoring of your blood pressure, but we don't have an ambulatory monitoring of your ECG, which is Holter monitoring. So I would say that in Nigeria, we still have a lot to do as per getting the equipment.
Okay.
But it's available. It might not be fully spread around, but what the NCS, Nigerian Cardiac Society, is doing is to help you understand that in every zone, there is a heart care specialist you can meet. There is a diagnostic center, there is a cath lab where you can have your interventions done. So somehow we've been able to spread all over the country. We are doing our best, but we can do better if we have the equipment. So
maybe you try to emphasize more on the preventing heart diseases, and so people can learn.
Okay, so talking about prevention, I've talked first about connecting with your heart. Listen to what the heart says. Any abnormal, undue hearing of the heartbeat, any abnormal palpitations, any dizziness, any fainting attacks, any undue easy tiredness, okay, is a sign that the heart needs to rest, okay? Any chest pain undue that you don't get better after taking pain reliefs, please seek the doctor. Also, hypertension. We cannot but overemphasize hypertension as a silent killer and the number one risk factor. So I say that everyone should check their blood pressure at least once a week. It's not too much. We have pharmacists out there, I mean, well-accredited pharmacists that can easily check your blood pressure. We have the digital blood pressure machine, which we ensure people to please get one. The digital, many brands, okay, you can, in the comfort of your home, check your blood pressure. Okay, so let me say, if you check your blood pressure at home and it is persistently more than 130/85, okay, that's one of busting the myths now. 130/85 with your own BP machine, it's important to seek healthcare. Okay. If you get up and you feel dizzy, we call that orthostatic hypertension. You feel dizzy, like fainting each time you get up from bed, or you are almost falling, or there are sudden blackouts. There are warning signs of stroke. Okay, you should seek help. You notice that your legs are swollen, or you notice you urinate a lot at night. compared to during the day. We call that nocturia. Okay, that's an early sign too of an elevated blood pressure. It's showing that the kidney is trying to take care of that pressure load. You should seek help. Okay, what other things can you do? You can do other things to keep active physically. You can wear a Fitbit wristwatch or any of these wrist app on your phone or as a wristwatch that helps you to keep track of your steps per day. Okay, being physically active is about making at least 5,000 to 10,000 steps per day, depending on your body weight. Okay, so we say go out there, check your body mass index. That is the relationship of your weight to your height. Know if you are on track. Know if there is anything you need to reduce your weight, okay? And then be physically active. Watch what you eat. A lot of fruits and vegetables goes a long way to help our heart. Okay, so we say avoid late night food. And if you are diabetes alone is equal to a cardiac problem. So if you now have the twin, hypertension and diabetes, is more problem. So say if you are diabetic, there are things you can do to cut down on your intake and make sure that you have a proper blood sugar level. So also for those that already have these diseases, in this ravaging pandemic, we employ them to stay connected to their doctor, either through phones or book an appointment, come. They should take the vaccines, they should take their medications regularly, and they should seek help before they have complications. Okay, so preventive is all about us. Exercise, diet, smoking, alcohol, avoid undue stress to the heart. Whatever will be, will be. Yeah. And talking about salt intake, we now have a low sodium containing salt out there that they now use more of potassium. It's been advocated that that is better than normal salt because that reduces the sodium that you consume. So what we say for every average man there, just not more than a teaspoon of normal salt in everything you eat.
Nigerians are used to eating fast food.
How
does that affect the heart?
Fast food is also a problem. Fast foods will cause what we call increased cholesterol level. And the cholesterol damages the vessels. Okay, so they block the vessels. The vessels are not as elastic as they should. So when blood clots there, it can get transposited to the brain and to the heart itself. So we say no to junk food. If you must take something in between meals, take fruits. An apple. Remember the nursery rhyme, an apple a day keeps the doctor away. Take an apple, take groundnuts, take cashew nuts, fruits and fibers, garden egg, and don't eat late at night. I remember my Lagos friends who say, you must fuel your hustle. What we are saying is that we should make conscious attempt to fuel and nurture that heart in a healthy way. So if I must fuel my hustle on the go, okay, I will not do junk. I'll do more of fruits.
Well, we're most guilty, journalists are most guilty. Eating late at night.
Well, what you can do is to take, I agree with you. What you can do practically, what I tell most of my clients is you can take a bowl of salad, always in the fridge. Okay, I realize that when you take some of these things, they're a bit more filling. Okay, so if you must eat at night, let it be fruit and vegetable. Let it be a bowl of salad, either vegetable salad or fruit salad that is ready-made. I'm sure Madam will be ready to do that easily for you. And then sometimes you go out there to exercise. You go out, yes, even you can say, oh, what is what we are eating tonight, and it becomes a practice. Even sometimes when we go out to exercise, you realize they finish the exercise, maybe on a weekend. TGIF or Saturday morning, they finish the exercise, and for men, they go down and had everything that they have bought. It's important to touch that because what we eat is what makes it. We cannot but emphasize that. I know it might be difficult, but it's make a conscious effort.
All of this comes with a whole lot of sacrifice and
discipline,
loyalty, discipline. You have to be loyal to particularly in our environment where we hustle from morning till evening and all of that. It appears what you are saying, doctor, is unachievable for
It
so,
is. It
for
is.
so many people.
No, I don't agree with that. It is achievable. That's why we say using your art to connect to everybody in the community. You have heard this today. People out there have heard us, okay? If you make a conscious effort that, okay, when we are together, okay, we must take healthy diet, and we stick to that. We'll make a conscious effort that I don't eat late at night. Once it's 7 p.m., 8 p.m., I'll take only fruits and vegetables. Eat all you want to eat during the day where you can burn it.
Okay.
All the issue, all the buffet.
Take it during the day.
During the day.
Yes.
Okay.
Take it during the day. You can burn it. It's digested.
Okay. As we're closing gradually, what other things are you doing on Wednesday?
Okay, so this Wednesday we will be doing some webinars. Just harnessing the advantage of the digital and technologies. Okay, we'll be giving lecture series, and then we'll be in the clinic on Wednesday to attend to everyone to ask their questions. There might be free drugs for those that already have this disease and cannot cope with buying their drugs. And availability, accessibility, what we are doing on Wednesday, and especially to give more health talks on that day.
All right, Moss, thank you so much for coming on this program this morning, all the way from Shagamu, right?
Yeah.
Dr. Francisca Inofomo, consultant, physician, and cardiologist, OUTH in Shagamu here in Ogun State. She's been talking about how we can improve access to heart care. And the World Heart Day is actually on Wednesday, but we felt we should look at this today, for you, our darling viewers. We must thank you so much for coming.
Thank you for
Thank you so
having
much.
me.
I wish you best of luck on Wednesday.
Thank you.
Okay, we'll take this break. When we come back, we'll talk about something else. Stay with us. Newdawn on the People's Stage.